Hi, I'm James Waslaski. I'm an author and an international lecturer on chronic pain and sports injuries. I was excited when I get the call from Karen Menahan from Massage Magazine to do an article on orthopedic massage. And with that being said, I want to quote the person that introduced me to orthopedic massage was Whitney Lowe, and I want to make his quote. I called him 25 years after meeting him, and I said, "What is your updated version of orthopedic massage?" And giving credit to him introducing me to this work, Whitney said, firstly, orthopedic massage is not a technique or a specific modality. Rather, it is a comprehensive approach that involves thorough assessment and a wide variety of treatment methods or techniques for using massage to treat soft tissue musculoskeletal disorders. And this reference, actually in 1995, was a game changer for me. Because if I get someone like Alex who comes in with carpal tunnel or thoracic outlet, first of all, most healthcare providers would say carpal tunnel is where, and they would point here. But the median nerve and the radial nerve and the ulnar nerves that are in here all start way up high in the cervical region. So some of the things you could look at in addition to a forward neck posture, which would drag which would basically drag the nerves into a long position like that, which have to be corrected. That particular cervical position, that forward neck, that OA joint problem, would actually cause a positive Spurling test. This one wasn't positive earlier when we checked Alex, but I'm just going to check it again. When we do the Spurling test, she goes into extension. She rotates this side. And when we just did this previously, Alex said, no, there's no increased numbness, tingling, paresthesia, pins and needles. So I'm not so concerned if I hold that for 30 seconds and there's no increase in numbness, tingling, paresthesia, pins and needles into the shoulder, arm, wrist, or hand, then I'm not concerned about that. But as you notice with Alex's rounded shoulders, accompanied by the forward neck, it positions the clavicle. When we're doing massage, we're positioning the clavicle down in the first rib. So a condition known as costoclavicular syndrome, which I can't diagnose because I'm not a medical doctor, would be evaluated through good orthopedic assessment tests. And this particular test would be called the Eden's test. That practitioner would check her radial pulse. He would then apply some downward pressure on the clavicle. And then it's also called the military brace test, because of Alex, if you contract your rhomboids and bring your scapulas together, just bring your scapulas back, what I'm feeling is a reduction of the radial pulse, which means an impingement of the subclavius artery, which means an indication to get the clavicle lifted up and off of the first rib, and then maybe activate the rhomboids for better clavicular stability. Another test that goes hand in hand for thoracic outlet patients, right along with the Eden's test, would be the Adson's test. Now, the Adson's test is really when these anterior middle scalenes, through deep inhalation, elevate the first and second rib. And the elevation of the rib is just as bad as the collapsing of the clavicle because it entraps the brachial plexus of nerves and the subclavius arteries. Alex, I'm going to do another test. I'm going to find her pulse. And then what I'm going to do is say it's nice and strong, but when she puts a stretch on her anterior middle scalene by turning this way, and she extends it back this way, and then she looks up and takes a really deep breath and holds that breath, again, I'm feeling a reduction of the strength of the radial pulse, so there's an entrapment of the subclavius artery, reducing blood flow. And Alex, this time you're feeling some numbness, tingling, paresthesia, so this one is definitely the highlight of her TOS. So for Alex, it's not so much the forward neck and the OA joint, but Alex's most compromised area is the clavicle and the first rib. So for the sake of this short video, we're going to show this on the skeleton, then we're going to get Alex on the table. So we've got to get the clavicle to drop, and we've got to use the ribs to stretch the intermiddle scalenes to free up the cervical nerve roots, which is called the brachial plexus of nerves. Remember, the branches of these nerves are what causes nerve pain in the arm, wrist, hand, and finger. So her carpal tunnel pain is actually a manifestation of compression here, where we've got scalene squeezing these, rib elevated on deep breath. So now, with good orthopedic assessment and clinical reasoning, we can apply the most appropriate treatment plan for Alex's condition. So Alex, you're going to go face up, and as you lie face up, head down this way. What we're going to do is we're going to show the listeners how to use a great technique, and for this one, friend, you're going to come a little bit closer with the camera. So here we've got if we go lateral to the SCMs, we've got the clavicular sternal attachments. If Alex's palms are palm up and she does bilateral abduction, bring your arms up towards your ears, This left clavicle, as you can see, is definitely not dropping. I mean, this right clavicle is not dropping, but the left one is. So do that one more time. Come on back down. And what you're seeing with this test is the left side, which doesn't have TOS. Go ahead, come on back up. But the right side is not dropping. So we're going to show you something to allow the clavicle to not be the culprit of the Eden's test. So I take my index finger and my middle finger at the sternoclavicular joint. I then have Alex relax, so just let your shoulder drop. And then I raise the clavicle up off that first rib to get some movement at the sternoclavicular joint, and then I clear out the adhesions. You notice how gentle this work is. A lot of people think deep tissue has to be painful, but it's just a nice, slow lifting of the clavicle as the shoulder drops on the table, getting that back in there. And we're showing how to clear out the adhesions between the clavicle and the first rib. And then I'm just going to walk around the table for a second. And what I want to do here is I want to have Alex's help. When Alex takes a deep breath, if I'm on the first rib and she takes a deep breath, the rib will come up. So we'll get a close-up of this one. Notice that again, as she exhales, the rib drops. So here's what I do. I get the clavicle off the first rib, and then I get on the first rib, finger pads. And remember, there's a subclavius artery and brachial plexus of nerve, so don't be pokey in there. Now, Alex takes a deep breath, and I let the rib come up, so deep breath. But on exhalation, I drop. I use the first rib to stretch the scalenes, and then Alex, you move your head all the way to the opposite side, and that gets the middle scaling. So if the head is straight, we get the middle scaling. Now watch again, deep breath. Let the rib come up. On exhalation, drop that first rib. Now turn your head towards me, Alex, and then you go across and get the anterior scaling. You know, only when you clear out the Sperling test for cervical nerve problems and the Eden's test for clavicular nerve entrapments and the Adson's test for the first rib scaling involvement should you be looking at things like pectoralis minor, which then we would go on and assess with the right abduction and hyperabduction tests. So what I hope this explains is that if Alex comes with a clinical symptom like carpal tunnel, which starts in the neck and shoulder, always clear out the spinal nerve. It's higher up the kinetic chain and work your way through it. And this is based on 3 new DVDs we just produced on releasing multiple nerve patterns of the upper and lower body, multiple nerve compression patterns of both upper and lower body, which would then allow Alex to do nerve glides, nerve flossing, nerve tensioning, and recover from what sometimes can be perceived as a complicated case of thoracic outlet or carpal tunnel syndrome. So I hope this and a series of other DVDs we'll be doing, and a series of the article that will be published in March with Massage Magazine helps you to understand the important role of orthopedic massage.